Somewhere in this country right now, someone is sitting at a kitchen table trying to figure out what just happened to their health insurance. They had Medicaid. They were eligible for Medicaid. They did not stop being eligible for Medicaid, but they got a letter saying their coverage was terminated. The reason, buried in the bureaucratic language, is that they didn't complete a verification process in time. A form they may not have known existed. Submitted through a portal they may not have been able to access. Documenting work hours for a job that may have had irregular scheduling and a boss who wasn't going to sign anything. This is the system working exactly as designed. On July 4th, 2025, Independence Day, which I will leave without comment, Congress enacted work requirements for Medicaid. The CBO projects 5.3 million people will lose coverage specifically through this provision. The stated justification? Fiscal responsibility. Stopping fraud. Protecting taxpayers from people gaming the system. I want to take that justification seriously. I want to follow the fraud argument wherever it actually leads, because when you follow it honestly, you end up somewhere Congress had no intention of going. Let's start with what Medicaid fraud actually looks like. According to the government's own accountants, CMS runs a program called the Payment Error Rate Measurement, PERM. It audits Medicaid payments and identifies improper payments, including fraud. After paperwork errors are stripped out, the actual fraud rate in traditional Medicaid is approximately 1.17%. Apply that to the $691 billion the federal government spent on Medicaid in 2025, and you get roughly $8 billion in annual fraud. That is not nothing. $8 billion is real money and it should be addressed. But hold that number. We are going to need it in a moment. In March 2025, MedPAC, the nonpartisan federal advisory body that serves as the government's accountant for Medicare, released its annual report to Congress. The finding was not buried. It was the headline. The federal government paid $84 billion more for Medicare Advantage enrollees in 2025 than it would have cost to cover the exact same people under traditional Medicare in a single year. Medicare Advantage is the privatized alternative to traditional Medicare. Private insurers manage coverage for about 33 million beneficiaries and receive a government payment per enrollee. The payment is adjusted upward for sicker patients, the idea being that covering someone with serious health conditions costs more, so the insurer gets paid more. The mechanism of the fraud is called upcoding. Insurers add diagnosis codes to patient records. Conditions the patient does not have, was never treated for, never complained of, in order to make the patient appear sicker and generate a higher payment. The Department of Justice described it plainly, adding unsupported diagnosis codes to patient records to secure higher payments even when enrollees do not receive treatment for those conditions. Kaiser Permanente paid $556 million to settle civil allegations of exactly this practice. It was the largest Medicare Advantage fraud settlement in American history. Kaiser did not admit wrongdoing. United Health Group, the largest health insurer in the country, which posted $447.6 billion in revenue in 2025, is currently facing an active criminal prosecution by the Department of Justice for the same conduct. Not a civil case. Criminal. Now do the math. Medicaid beneficiary fraud. Approximately $8 billion per year. Medicare Advantage insurer fraud. $84 billion per year. The fraud being committed against the government by the insurance industry is 10 times larger than the fraud being committed by the people Congress just stripped of their health coverage. And while the criminal prosecution of United Health Group was proceeding, the Trump administration proposed increasing Medicare Advantage reimbursement rates by $13 billion. 10 to 1. And they gave the 10 a raise. Before we get to the largest fraud of all, let's look at what the work requirement has actually produced in the real world. Georgia ran the only active Medicaid work requirement program in the country before the national law passed. It was called Pathways to Coverage. The Government Accountability Office, the government's own watchdog, documented what happened. From 2021 through the first half of 2025, Georgia spent $54.2 million administering the program. In the same period, it spent $26.1 million on actual medical assistance for enrollees. The government spent more than twice as much checking whether poor people deserved coverage as it spent covering them. Of an estimated 175,000 people eligible for the program, approximately 6,500 enrolled. Millions of dollars went to consultants. Monthly verification requirements were scrapped because the administrative costs were ballooning out of control. Montana estimated it would need to hire 50 additional staff just to handle more frequent eligibility checks. The CBO's $326 billion in projected 10-year savings, roughly $32 billion per year, does not account for any of these implementation costs. CBO explicitly didn't calculate them. The gross savings figure is the number Congress cited. The net figure, after you subtract the cost of building the bureaucracy to enforce it, is smaller. How much smaller, we don't know precisely because Georgia is the only data point we have. And Georgia's data isn't encouraging. I want to stop here before we get to the largest number because the largest number is a fiscal one. And fiscal arguments have a way of making people feel like we're talking about spreadsheets rather than human beings. But we are not talking about spreadsheets. 100 million Americans are currently carrying medical debt. The combined balance is $220 billion, 36% of American households. These are people who got sick, got a bill, and couldn't pay it. Not because they were irresponsible, but because the bills were unpayable. No other wealthy country produces this outcome at this scale. Medical bankruptcy contributes to approximately 2/3 of all personal bankruptcies in the United States. It doesn't exist as a meaningful statistical category in Germany, France, Australia, Taiwan, or Japan. Not because those countries have fewer sick people, because those countries have a different financial architecture. Medical bankruptcy isn't a personal failure. It's a design feature of a system that was prevented from changing. 47% of Americans delayed or skipped medical care last year because they couldn't afford it. 78% of millennials. Johns Hopkins research published in 2025 found that delays of even 1 to 3 weeks in beginning cancer treatment correlate with meaningfully worse survival rates. People are dying of conditions that were caught late because they couldn't afford the appointment that would have caught them early. About 25% of workers who would otherwise leave their jobs don't, because leaving means losing their health insurance. They stay in positions they are wrong for. They don't start the company they were going to start. A quarter of the American workforce is making career decisions based not on economic signals, but on insurance contracts. Families are spending down lifetime savings, sometimes everything they ever accumulated, to qualify for Medicaid long-term care. The rules require you to be nearly destitute before the government will help. People who saved carefully and did everything right watch their assets disappear, paying for a parent's memory care at $8,500 a month, until there is nothing left and Medicaid finally steps in. This is not an edge case. It's the American long-term care system. More than 140 rural hospitals have closed since 2010. The maternal mortality rate in the United States is the highest of any wealthy nation. Black women die from pregnancy-related causes at approximately 3 times the rate of white women, a gap that persists across income and education levels. People are rationing insulin. In 2025, in the wealthiest country on earth. These are not abstractions. They are the compounding human cost of a system that was prevented from changing. They are not accidents. They are the receipts. Now we get to the largest fraud of all. 19 of 22 economic analyses of single-payer healthcare agree that it would produce net savings in the first year of implementation. Not eventually. In year 1. The savings come from 2 primary sources, eliminating approximately $500 billion in annual administrative waste, and using the government's purchasing power to negotiate drug prices the way every other wealthy country does. The most conservative 10-year savings estimate comes from the Mercatus Center at George Mason University, an institution funded by Charles Koch, whose political network has spent decades opposing government expansion of any kind. Even that study, built on the most cautious assumptions available, found that Medicare for All would reduce total national health expenditures by $2 trillion over 10 years. The Political Economy Research Institute at the University of Massachusetts put the 10-year savings at approximately $5 trillion. The range is $2 trillion to $5 trillion. The floor comes from the opposition's own researchers. Now ask, who prevented this from happening? The Partnership for America's Healthcare Future was formed specifically and exclusively to defeat single-payer. Its members include the American Medical Association, PHRMA, the Federation of American Hospitals, and Blue Cross Blue Shield entities. The healthcare sector spent $439 million on lobbying in 2025 alone. Medicare Advantage insurers deployed more than 220 lobbyists on Capitol Hill and spent $330 million lobbying over 5 years. The industries doing this lobbying are the same industries generating the $84 billion in annual Medicare Advantage overpayments. They are calling single-payer fiscally irresponsible, while their own researchers document $2 trillion in foregone savings. They are invoking government waste while billing the government $84 billion a year for diseases they never treated. The $2 trillion in savings that didn't happen, trillion in savings that didn't happen. The $500 billion in annual administrative waste that kept running. The drug prices that stayed 3 times higher than peer countries. The MA overpayments that kept accumulating. Is the largest healthcare fraud in American history. It is not prosecuted because it is legal. It is legal because the people committing it spent $439 million last year making sure it stayed that way. I am not a lawyer, and I am not making a legal argument. But in plain English, fraud means deliberately misrepresenting material facts for financial gain. The industries opposing single-payer have known for years. Their own researchers have documented that the current system costs more than the alternative. They have represented to the public, to Congress, and to the media that government-run healthcare would be fiscally irresponsible. They have done this while extracting $84 billion a year from the government program they administer, while billing for diseases they never treated, while a criminal prosecution winds its way through federal court. They told you the fraud was the person who couldn't navigate the Medicaid paperwork in time. The actual fraud is 10 times larger and comes with a lobbying budget. Here is what I've learned about how this works. The industries blocking single-payer don't win because they have better arguments. They win because they show up every single day. In committee hearings, in regulatory comment periods, in agency meetings, in re-election fundraisers, regardless of who won the last election. The $439 million in annual lobbying doesn't take election years off. It doesn't take summers off. It doesn't graduate and lose its institutional memory. It just keeps showing up. You voted. You probably called your representative at some point. Maybe you donated. And the $84 billion kept flowing, and the $2 trillion in savings kept not happening. That is not your failure. That is what organized institutional power looks like when it faces fragmented and unorganized public frustration. Frustration without organization hits a wall that was built specifically to absorb it. The wall doesn't come down through individual action. It comes down when enough people who are frustrated about enough different broken things find each other. Recognize that the power players blocking reform in healthcare are largely the same power players blocking reform in drug pricing and campaign finance and a dozen other areas, and start building something that shows up the way the other side shows up, continuously, across election cycles, with institutional memory that doesn't reset every 2 years. That is specifically what americasplan.org is built for. Not to tell you what to think, not to push a party line. To be the place where the person who came in on healthcare fraud meets the person who came in on drug pricing and the person who came in on campaign finance, and where together they start to see the common thread and build the common response, a counterforce to the power players. Organized, continuous, cross-issue, the kind of civic pressure that doesn't depend on any single election and doesn't evaporate when the news cycle moves on. I built this platform because I got frustrated enough to do something about it. I want to be honest. It is early, it is unproven, and we have not yet demonstrated the outcomes that would justify stronger claims. But the receipts are in. The fraud is documented. The human cost is documented. The power players are named. What's missing is the organized counterforce. Come build it with us. Americasplan.org is one click away.